afternoon, everyone. My name is Amarjot Sandhu, and I'm the member of Provincial Parliament for the Great Riding of Brampton West.
No audio.
In Queen's Park, it is my duty to listen to my constituents and understand how can we help them. What I hear is that the people of Brampton want opportunities close to where they live, to learn, to work, to raise families. And they want to increase the healthcare workforce to be prepared to handle our rapidly growing population. Under previous government, Brampton was neglected for far too long. I'm proud to be a strong advocate for this city. Premier Ford, Minister Sarkarias, Elliott, and Dunlop, and I all agree that Brampton must get its fair share. There's so much talent and skill in our great city. Brampton is one of the youngest cities in the country. That is why our government is focused on helping the youth in our community grow and prosper. Everyone here has worked tirelessly to ensure that the people of Brampton get the opportunities they deserve. I'm honored to invite the Premier of Ontario, Doug Ford, to the podium to announce one more way that this government is delivering for the people and families of Brampton. Thank you.
Well, good morning, everyone, and thank you, MPP Sandhu, for that introduction. You're a big reason why we're here today making this announcement. We're also joined by Minister Dunlop, Minister Elliott, and Councillor Charmaine Williams, which were all instrumental in this. And as well as the person that controls the money, as I always say, I love the people who control the money, the President of the Treasury Board, Pramit Sakaria, who's done an outstanding job delivering for the people of Brampton South. Also, as I say, the architect, the Commander-in-Chief, Dr. Mohammed Lashemi from Ryerson University, who has been leading the charge to make this incredible announcement possible. Dr. Lashemi, thank you. Thank you for all your leadership and your work. Friends, after 2 very long years, we've come so far. Because of the sacrifices made by Ontarians and the amazing care provided by our healthcare heroes, we've been able to safely and cautiously reopen our province. After decades of underinvestment, this pandemic stretched our system to the limit. But now, looking ahead, we can be confident that Ontario is better prepared for the future. We're producing more of the masks, gowns, gloves, goggles, face shields, and ventilators we need here at home. Because of our ambitious plan that's building Ontario, we're adding thousands of hospital and long-term care beds. With the support of our government's historic funding, fast-growing towns like Brampton are attracting more doctors, nurses, and personal support workers to care for patients. But we can do more to build a stronger, more resilient health system. A big part of that is ensuring we're training the next generation of world-class health professionals and making sure that we are providing the opportunities for more women and men to get the schooling they need to become the doctors of tomorrow. That is why I'm proud to announce our government is making a major expansion to the medical education in Ontario and adding 160 undergraduate positions and 295 postgraduate positions to Ontario's medical schools. This is the largest expansion in more than 10 years, and it will create more spaces at all 6 medical schools across the province, further delivering on our promise to bring high-quality health care to all parts of Ontario. But most exciting of all, we're building the brand new Ryerson School of Medicine that will open right here in Brampton. Our government is investing in training the doctors who will serve this community at a new hospital for Brampton that we announced last summer. We want doctors from this community, trained in this community, serving this community. Ontario's doctors are some of the finest in the entire world. We've seen that proven every day over the last 2 years. With this investment, we're supporting more students to take the path to becoming a doctor and creating the family doctors and specialists that will take care of us in the years to come. And we're bringing these opportunities to our growing cities like Brampton, where there is so much talent and strong desire for people to give back to their communities. This is just one part of our efforts to strengthen our healthcare workforce. including adding 5,000 new and upskilled registered nurses and registered practical nurses, as well as 8,000 more personal support workers. With these investments, we're putting the health of Ontarians first and building a stronger healthcare system for the years to come. Our province has come so far, and we can't afford to go back to the politics of no. Instead, your government is saying yes. Yes to training more doctors and nurses, yes to investing in our communities, and yes to building a stronger, more resilient province. Friends, let's say yes to the better and brighter future that the people of Ontario deserve. Thank you, and God bless the people of Ontario. Now, I'll hand it over to my good friend, Dr. Washemi.
Thank you very much, Premier Ford. This is a great news for the people of Brampton and Peel region. I want to thank all of the government representatives who have played a part in making this a reality. I would also like to extend a special thank you to Dr. Frank Martino, interim President and CEO of the William Osler Health System, who is here with us today. Throughout this pandemic, the government's decisions have been guided by concern for the well-being of the people of this province. That same focus brings us here today. For the past 2 years, the people of Brampton and Peel and Ryerson University have been working to shape plans for a new kind of a medical school, an innovative school that reflects the needs of this diverse and fast-growing region. Brampton deserves a medical school that is based on the kind of healthcare this community needs. Today's announcement is a major investment in the future of Brampton, and we thank Premier Ford and his government for this demonstration of confidence in Ryerson to help make this happen. Thank you very much.
We'll now take questions from the media. If reporters with questions could please form a line behind me at the microphone. It'll be one question and one follow-up per reporter, one at a time.
Premier, good morning. It's Richard with City News.
Richard, how are you?
I'm good, thank you. Unfortunately, we've seen this BA2 subvariant cause a lot of trouble overseas. Half of European countries are seeing cases surge, hospitalizations too. Scotland, within the last hour, decided to reverse its plan to drop its mask mandate. Hospitals in Hong Kong are overrun, 37 million locked down in China. Premier, I'm wondering what you think about when you hear these reports.
Well, we're always very cautious. I just want to remind everyone, per capita, we have the lowest hospitalizations, I think, next to PEI. But I'll always be cautious and move forward slowly. And we've built up our healthcare system. We've built up our healthcare system to be able to handle increase, and we've learned a tremendous amount over the last 2 years. But maybe I'll bring Minister Elliott up. That's deals with this day in and day out.
Well, we have been following the BA2 variant very closely. Dr. Moore is studying it. We expect that it may be the 50% of the cases that we have in Ontario within the next short period of time. But the evidence suggests that in Ontario at least, it is a subvariant of the original Omicron variant, and it's not causing many more hospitalizations or more intensive treatments. But we're keeping a very close eye on it and are very cognizant of what's going on in the rest of the world. But as the Premier said, we have built up our system. We've built up another 3,100 extra beds. We're training the Health Human Resources with this announcement today. And Dr. Moore feels that we will be able to handle this variant without any further disruption to services in Ontario.
Thank you, Minister. Premier, on the mask mandate, which you're dropping next Monday, a number of colleges and universities and private schools have decided to keep the mandate in place for their students. How come they get to make that decision without jumping through any hoops, but the public boards don't, sir?
Well, again, that's going to be up to each university and each college. We have our minister here, Minister Dunlop. You want to speak on that? Yeah. Then I'll hand it over to you. Thank you.
Thank
Thank you, Premier, and thank you for that question. As you know, universities and colleges are autonomous legal entities, so they are able to make those academic and administrative decisions for themselves.
Hello, Premier. Natasha MacDonald, Radio Canada.
Hi, Natasha.
Premier, will you be supporting Patrick Brown, Pierre Poilievre, Jean Charest, or any other candidates in the federal Conservative leadership race? And will you be allowing your MPs, ministers, to publicly support the candidate of their choice?
Well, great question. The answer is no. I'll be supporting the people of Ontario. I have my hands full moving forward. And as for our MPPs, I believe they'll have their hands full, so no, they won't be supporting anyone.
Minister McNaughton this morning was talking about 30,000 jobs for Ukrainian refugees, but your government has yet to allocate specific funds or say for resettlement or say where those refugees would be housed. So can you give any details on that and say if any of those jobs would be available as well for Afghan refugees?
Sure, we welcome everyone. First of all, let me address what's happening in Ukraine. My heart breaks for the people over there. They're so resilient. They're some of the strongest people I've ever seen, and fighting against this tyrant, which the whole world has to fight against this tyrant. And as for the people coming here, we welcome them with open arms. We have over 200 companies and 30,000 positions available, and that's just the 200 companies that have come forward. We'd be working with settlement services as well. Our goal is to make sure they have safe haven when they come here, and we'll make sure that that happens. And again, we have a tremendous amount of opportunities for them, employment here in Ontario. I guess the federal government's job is to get them here. Once they're here, they'll be well taken care of, not only within the Ukrainian community, but from everyone in Ontario.
Hi, Premier. Holly McKenzie here with Canadian Press. Asking about the PSW wage increase that was temporary and extended since 2020. Can you just explain why you can make it permanent now after all this time rather than, you know, in 2020? And related to that, why take this approach of giving raises to particular health worker groups rather than just get rid of the Bill 124 like the unions are asking for to allow higher wages?
Well, thanks for that question. We've seen over the last 2 years how they've stepped up to the plate. They've done an incredible job. When we saw the challenges in long-term care, who stepped up? All the PSWs. For years they were ignored, they were underpaid, overworked, and we acknowledge that by giving them the $3 an hour increase. We are going to make it permanent, and it's well deserving. They work so hard, and we all saw it firsthand.
And on another topic, college professors, instructors, and other academic staff are planning to go on strike Friday if the colleges don't agree to send their negotiations to binding in just arbitration. What's your reaction to that, and do you think the timing of a full strike makes sense? I don't like when anyone goes on strike, especially in these conditions when we went through such tough times. But again, I'll call my great minister up here and she can answer. Well, you got a busy day today. Questions?
Well, thank you for the question, and you know, we are monitoring the process quite closely. I've heard from students and from parents who are very upset. Students cannot afford a strike at this time. They're finally back in the classroom. That's where they need to be. That's where their best education is, where they're collaborating with their colleagues and their faculty. You know, we've seen the resiliency of faculty, students, and colleges come together during COVID to ensure that students continue their education. And so I hope to see everyone back to the table and making sure that we respect the bargaining and come to a deal.
Well, Premier, this is Grant Person from the Brampton Guardian. Just wondering about the timelines for the medical school, when they're planning on opening and what's going to happen with that.
Well, we'll do it as quickly as possible, but I'm going to send it over as I joke around with him, the Commander-in-Chief. Dr. Lashana.
Thank you very much for the question. In terms of timing, we have to work with the community, and we have engaged the community here in Brampton and the Peter region in many conversations. We'll continue those conversations. We are also actually in conversation with the city of Brampton, because it's important to work with the leadership of the council there. In terms of timing, I think we are very optimistic about the first cohort of students in September 2025.
Next question would be just about the hospital, the Peel Memorial expansion. Any updates on that, or where are we at on that? Biology still planned for opening in 2023, or?
It is, and I hate to keep passing the questions because this falls under the minister, so maybe the Minister of Health can come up. But with that, we're gonna move as quickly as possible. If they need MZOs, we'll issue the MZOs to get that hospital up and going. They were ignored from the previous administration for decades. This is a growing community, and we need to make sure that they aren't forgotten about.
We certainly know that the people of Brampton need more health services, and we have already invested over $18 million in expanding the care that's available 24/7 through the clinic. But we're also working very closely with them to get the final drawings ready as soon as possible, move them through the ministry, and get the shovels in the ground as quickly as we can.
This will be the last question.
Hey, good morning, Premier.
Colin.
On the PSW pay, I know part of the hurdle before was you were giving money to the corporations, which then had to give the money to the PSWs. How did you guys figure a way around that hurdle? Are you guys paying the PSWs directly? Could you take us through that?
Well, again, I'm gonna go back to the reason why they got the pay, Colin. They got the pay because they've worked their back off and they've been ignored for many, many years from the previous administration. Now we're gonna implement it as a permanent pay hike, as a $3 increase, and it's well deserving.
Okay, and on another topic, masking. So next Monday, the return of the legislature, of course. What are you telling your progressive conservative MPPs? Are they allowed to, in the legislature, wear their masks if they want to? Or is the edict from the Premier's office, you know, March 21st, masks off, we'd like you to keep your masks off?
No, that's gonna be up to them, and it's really, again, up to the Speaker, which has done an incredible job. And I'll say this about all parties. No matter if it's the Green, the Libs, the Dippers, or the PCs, you know, everyone's gonna follow the proper protocols, and if you wanna keep your mask on, God bless you. You can keep your mask on, and if you don't, then that's fine too. But I always side on the air of caution, and for the first few days, I'll be keeping my mask on.
Thank you, Premier.
Thank you. Thanks, everyone.